Fall. Now relax this arm. Drop.
Oh, Tubio Lift, huh? Thank you.
You're welcome.
Thank you.
What's up, YouTube fam? This is Dr. Alex Tubio. Thank you again for joining me on this video. Now, this video is a very special video. It's a very emotional video in which the patient here gets such an emotional and physical relief that she begins to break down a little bit. But it's so awesome. It's so awesome to see somebody get the relief that they're looking for. This is what it's about, guys. It's not about the views. It's not about the likes. It's really about the patient that I do see every single day, and I love it. There's nothing, honestly, that compares to seeing somebody get the relief. It's so rewarding, and it's really the reason why I got into this profession. And if you guys are experiencing any of these symptoms that she's going through right now, let me know in the comments below. Maybe I can guide you through some things, or at least point you in the right direction so you guys could get help. Also, while you're at it, make sure you guys like the video. Also, subscribe to this channel as well too if you like the content. And also hit that notification bell so you guys are up to date on every single video that I am putting out there. It's twice a week, so you're not gonna wanna miss it. All right, so I'm gonna shut up. We're gonna get to the video. Let me know what you guys think, all right?
All right.
Well, help me find you. So
yeah. Well, I'm happy about that. So we are going to go through exactly what's going on with you, okay. Right? See what's bothering you, and then from there we'll get you treated. Okay. And then go from there.
Cool.
Right. Are you pregnant?
Yes.
Ah. Okay. Good. Okay. So tell me what's going on with you.
Okay. So I'll just start from head to toe. So I've been in web development for 5 years, so I'm constantly at a computer and typing and like, you know, messed up. I try to make my area as like ergonomic as possible, but I have a big slouching problem. The neck, shoulder area is really bad, but this shoulder specifically, it, like anytime I move it, it cracks. And if I raise it up like to like for more than like 30 seconds, it hurts. Like it's uncomfortable pain.
What do you mean it hurts? Where does it hurt?
Like right here, like this, I don't know what tendon is there or whatever, but the last time I got x-rays, there was something, I forget what it was, but there was something up in there. I think this comes from like a really old lacrosse injury that I just never got fixed. From like 10 years ago. What happened? Do you remember? I think I just like threw my stick like 2 inches.
So you didn't get like smashed or anything?
No, it's just like, I think I just threw my arm out of place or something. So that always cracks, and it keeps me, I'm always doing this. You're always doing that? Okay. Always, constantly. And then I just have lower back pain. I think that just comes from like sitting and just regular life. Yeah. When I had my last x-ray done, my last 2 vertebrae are like, there's not much space in between them. So if they're not exactly like
so on top I bet it's always stiff there.
Yeah. Yeah, and then with the pregnancy, it's even been getting worse. So that's just really uncomfortable. And if I sit, and I'm sitting at a computer all day, so
how many hours a day?
Like 8 to 10.
Ooh. So that's going to be your issue. Yeah, honestly,
that's the biggest one.
How often are you getting up and stretching and moving and stuff?
I get up pretty often, like every hour. I try to move around. Okay. And like I stretch because I get uncomfortable, and I need a new chair. But my life's pretty sedentary, like as far as like sitting down. I mean, I work out, but it helps relieve the pain when I work out.
Yeah, of course.
But it's constant.
Okay.
And then my wrist from all the typing.
Gotcha. So kind of just like you're experiencing the normal symptoms that I don't say normal, but you're experiencing similar symptoms to people that do sit for a long bit of time. I mean, when I'm looking at you, honestly, I see this, right? I can see how tense you are. I can see how the shoulders start to round forward. Right. And even though if the shoulder injury started whenever you had that, whenever you were playing lacrosse, it hasn't gotten better because the shoulders start to rotate internally. Right. Right. So whenever you're sitting at a computer desk, I mean, everything's like right here. Right. So you're typing, you're doing all these different things, and you're starting to slouch more. Yeah. So day in and day out, it starts to curve in, and then different things become weakened, some things become too stretched out, some things become restricted, and that causes a lot of the weakness and imbalances in that shoulder, so it's not able to really heal, to be honest with you. So you have neck issues, so like neck, shoulder issues. You have mid-back issues too?
Yeah.
Yeah, lower back issues. I know you have lower back stuff. Do you get migraines and headaches?
Lately.
Lately you have. How, when you say lately, what is it?
Since I got pregnant. So I don't know if it's related to the pregnancy or
it could be.
If it's related to the pain.
I think it could be a little bit of both. There is something to be said about the timing of everything. So, I mean, when you're pregnant, I mean, so many different hormones are just going. I mean, including another hormone called relaxin. So it just, it's moving everything in your hips. So it's always hard to really gauge if what you're going through right now is something that'll be relieved after you're done with pregnancy. Yeah. Right? But if you're having these issues even before pregnancy, then those
I didn't really have migraines prior.
Okay.
Yeah.
I still do believe that you don't want to keep this the way that it is. Right? Because there's still, I mean, when you're pregnant, I mean, different things start to happen, but your muscles become tightened, and if your body's not on the right foundation even before you get pregnant, it's just going to aggravate it even more.
Exactly.
How long have you been dealing with all this stuff for?
At least 10 years.
Ooh, it's a long time.
Yeah, and I've seen different chiropractors, and I get like temporary relief, but it doesn't feel corrected.
Right.
You know?
How when you say temporary, how long does it normally last for you?
I don't know, like a few days.
A few days?
Yeah.
How often do you normally go?
I try to go bi-weekly.
Okay.
But sometimes budget doesn't.
Right. I mean, here's the thing. I think I've seen a lot of people that are pregnant, right? And they come in and they go through these different things. It is really important to get adjustments as you go through pregnancy. Right. There has to be, for us, like, there are plans that we can do. I know you're coming from San Antonio, so it's a long way, but and I don't have any contacts in San Antonio, but if you're able to get on a consistent basis, right, that will absolutely change your life in that sense, because you have to think of the ratio of everything, right? So when you get a few days of relief, think that's a really good plus, because you're combating basically 8 to 10 hours of every single day and not able to move and do things the way that you need to, and you're putting more stress on your body. So even when we take off the pressure from the adjustments, right, then what do you do tomorrow? You go back and you sit down. So the way to prevent a lot of those things from happening is to do concentrated exercises that are going to help you, right? More than just stretches and that. Then I'll give you some before you leave so that you have a better understanding of what you need to do, right? Because the reason why this is happening and this is happening and this is happening is because even when you're sitting or even when you're standing, I can see it, your body's already just like this. So we have to strengthen the posterior muscles or the back muscles so that everything starts to return backwards. That'll keep the adjustment a lot more long lasting, but it's not until you really truly change your lifestyle habits, right? You're not, I mean, here's the thing, you're not going to quit your job, but what you can do is do things in between. Instead of just like walking around and standing up and getting up, there are things that you should do in between those times that you are standing up, and things that even when you go to the gym or you work out that you should do so that you can strengthen. Like this part of your body, like this portion, you really don't need to strengthen this anymore, right? What you need to do is stretch this out. What you have to do is strengthen the back, right? The back, the mid-back, the neck extensors, because that'll pull everything back up this way. All right? We can't take x-rays on you though, right? Because you're pregnant. So what we're going to do, how many weeks are you pregnant?
12.
12. Okay, so you're still...
Ending.
It's like you're like in between.
In between.
Okay. You're not really showing that much, to be honest.
Well, thanks.
So what we're going to do, we're going to get everything loosened up first, and then after we get everything loosened up, then we'll get you adjusted.
Cool.
Sound good?
Sounds good.
You excited?
I'm so excited. I've been following you for so long.
That's so awesome.
I was just like, I watch your videos at night. I'm like, oh, I'm just pretending I'm getting adjusted.
Do you watch YouTube videos too?
Yeah.
Okay, cool. All right, so... a little bit lower here. Does that feel okay? So you see how there's this curvature that's down right here? This is due because of the posture from your sitting. So this is the area that bows out the most. So we have to extend this going back upwards. How does that feel there?
Oh my god, big stretch.
Good.
I really feel that like on my tailbone area.
Oh, I can feel all that. Alright. So we're gonna start on this side and then we're gonna finish on this side here. Okay. So you're gonna turn that right there. That's good. And I want you to let this fall. Now relax this arm. Relax your head over my hand. That's it. Relax. Give me. I can feel you tensing. Don't tense. Let it just drop. Fall. Drop. Drop.
Oh! Oh my God. Okay. Woo! That was that Tubio Lift, huh? Yeah. Woo! Okay. The hype is real.
The hype is real.
Okay.
You're right.
Yeah. Yes. Yes. I'm good.
You're right. Let me know when you're ready for the next one.
Okay. Yeah. Yeah. Let's do it.
That was intense, right?
Yeah. It was the best intense.
Alright. I can feel it. You see how like this comes in just a little bit more like this? Mm-hmm. You want it to pull outward. So we're going to push this way and pull.
Ooh, yeah. Oh my God.
Felt pretty good, right?
Yeah, let's do this one.
We're gonna do this one too. And then, yeah, see right there, and then up. That's where it is. Relax your stomach. That's it. Good. It's like you got new ankles.
I know. I needed that.
Let me see your. I'm gonna go with the elbows now.
Okay.
You feel that right there. That's good, right there.
Mm.
That's a lot.
Mm.
Pull. That's good. Let's see this one here. Yeah, right there. Good.
Ooh. Oh, yes. Oh my God. Yeah, okay.
Okay.
I'm ready.
And then we're gonna feel that right there. Here.
Mm.
Good.
Yes.
Good.
The last chiropractor I went to, he literally was like, woof, to my whole body. I was like, yeah, I know. Oh, God, yes.
Yeah.
Oh, yeah. Okay.
Feels good, right?
Yes.
Go
Oh,
ahead.
my God.
We're gonna get right here now. You're gonna turn. That's good. That's beautiful right there. So I'm gonna move your head just a little bit out right there. Let this fall more. Let it drop. Good, let it fall now more.
Oh. Oh, I think I went cross-eyed. Oh my God. Mm. Yes. Okay. Wow. I feel like that went in my eyeball, like.
Yeah.
Oh, that was crazy.
This area right up there, that occipital area, when you sit down, this area and this area are the most affected.
Yeah.
So what we did is just open this area up
God.
again. How did that feel?
Amazing. Oh, because I'm always like trying to
Do something and it doesn't, right?
It's very rare that it does, and when it does, it's like, you know? But that was like a different level. What's next, Doc?
No hip surgeries, nothing. So I'm gonna put my hand right here and we're gonna pull down, just like this. Tension is right there. And let that go down. That's it. Good. All the way up. Here it goes. Do it one more time and let that out. That's it. Good.
Ooh. When I put it down, I went.
Yeah. So keep this bottom leg straight. Keep this bent. And what I want you to do is scoot your hips all the way to the edge. Right there. That's great. Let me see your arms. Let me see this. Good. Interlock your fingers. You're going to go just like that. Do this. So we have to flatten this back out. Here we go. That's it. Pull. Good, relax your stomach just a little bit more and let that go. Good. You alright?
Mm-hmm.
All right.
Yeah.
Go ahead, as close as you can. Let this hip roll a little bit more. That's it. Good.
Ooh. I try to do that myself so many times.
Yeah.
Okay.
That's why you're here, though, right?
Yeah.
You feel okay?
Mhm.
So what I do notice here is that when we look at the heights, right? This side is definitely higher than this side here too. So we're gonna adjust here, but we're gonna be pushing. So what I'm imagining is that there's maybe a small curvature that's moving off to this right side here. So we're gonna be pushing on this curve, and then we're gonna rotate down.
Okay.
Just like that, so we can start to pull that back. But I can feel, this is where you get most of that tension, to be honest with you. Even though if that's not the most, if that's not the worst part, this is contributing to the worst part.
Yeah.
So we're gonna use this here. Alright, so we're going to start in this area right there. So I'm going to start right here. So I want you to take a deep breath in for me. Let all your air out. Let that, that's good. Good. How does that feel?
Good.
That's it. Lift your head all the way up. Let your head go back down. And all you have to do is just relax. Just lay there like you're sleeping. So I'm going to do this just a few times so that we can open. Do you feel that going down your spine?
My neck is like...
What do you feel in your neck?
Oh, God. It's like so tight, but it's like...
It's opening, huh?
Yeah.
There. That's your opening right there. So I want you to take a deep breath in and let that air out. Let's do that one more time. And exhale all the way out. Good. Interlock your fingers, bring them higher to your chest.
Oh my God. Woo! That was shocking. Oh God. Oh, that was nice. Whew. I felt that, like that last vertebrae, I really felt that. Ooh.
Felt that open up down there?
Mm-hmm. Oh, I haven't felt that open since my childhood, I feel like. Whew. That was intense. Okay. I feel like I can't move. I'm like...
That's okay, just stay.
Okay.
It's a pretty big shock. Let me take this in. It's a pretty big shock at first. Because your body's like, what the hell just got happened?
Yeah, it's like, woo. Oh my God, my neck and like that last hip, tailbone area is experiencing new things right now. I'm like paralyzed.
That's okay. That's okay. No, I totally get what you mean. I totally get what you mean. You just stay there until you're ready to come out.
Okay. I'm like melting into this.
Is that as good as you expected it?
Yes, yes, yes. Oh, I can't wait till like more of this. Like, oh my gosh.
You're gonna drive back down.
I'm like, we're moving to Houston. Like, wow, that's crazy. This ain't cracking no more. Oh my God. Oh, I could cry. Ooh. Oh, I'm crying. Oh my God. That's not cracking. That's crazy. I'm pregnant. I'm emotional. Like,
That's okay.
oh my God, that's wild.
I'll tell you this, don't try to keep doing it.
Okay, yeah, sorry.
It's a little unique because since you do that all the time,
yeah.
it's loosened up a lot of those ligaments, right? But a lot of the shoulder issues that do stem from a lot of people is because of up here and up here, right? So once we opened everything back up, the nerves can actually finally fire into those areas.
Whew, this is wild. Oh my God. Okay, let me get my emotions.
You're okay. You're totally okay.
Oh. Okay. Wow, that's crazy. I feel new.
You got the full body adjustment.
Yeah. Yes. I sure did. Like this. I can't wait to walk. Like, what's that gonna feel like?
Yeah. How do you feel right now?
I feel like in a new body.
That's awesome.
Yeah, like, I'm emotional.
That's
like,
okay. No,
this makes me emotional.
That's fine.
Thank you.
You're welcome.
Thank you.
I'm gonna grab you a tissue.
Yeah. Thanks. Wow. And I can adjust it a lot. Like, that was great. Thank you.
You're welcome. You're so welcome.
Oh my God.
I have to leave you with some exercises though.
Okay, yes, please.